Welcome to The Rounds. I'm here today with Dr. Mark Del Beccaro, Chief Medical Officer at Seattle Children's. We're here today to talk about one of our key strategic initiatives, digital health. So Mark, thanks for being here.
Glad to be here.
What does digital health mean to you when we talk about that?
The way I look at it, it's really how do we do healthcare taking into account the tools that are available to us now that weren't available before, and that includes everything from computers to internet to people's personal phones. This is a generation of people that are grown up with that, and we have to take advantage of those things.
Is there a reason why digital health is going to be even more important for Seattle Children's?
I always like to point out that we take care of 1/3 of the landmass of the United States. So thinking that they could get to us or we can get to them in person every time is really just an old idea. As we send families home from visits with us or inpatient or a clinic, no matter where they are when they get home, we need to be able to give them the tools to be successful. It doesn't totally replace, but it absolutely has to augment how we do that work.
How do you see digital health making the day-to-day work and jobs of our individual teams here at Children's better?
As any provider will tell you, they feel like they just have not enough time and too much coming at them. And still, unfortunately, even though they have some things that right now require them to log into systems, whether they're home or somewhere else, they're time consuming, they're not quite as fluid as we would want them to be, and we need to recapture as much as that time to make it fluid and easy for them. As we think about the changing way that we're going to do healthcare and how we have to partner with the community and how we have to partner with other organizations, we need to be able to do that in a way that doesn't require the intense manual processes that we have now, and so we have to be able to integrate electronically with them.
So Mark, give us one example of a recent digital health success.
We've had a little bit of work with the digital health team where they have helped the transplant services take a lot of the teaching that takes days before somebody can go home and putting some of that into an application that families can use at home, but they can also use it as they're getting ready to go home. And they've told us that it's much nicer than just being taught in a sort of verbal and paper-based system. And it gives them something that they can refer to after.
So how can digital health help us reduce health disparities?
Partnering with the Community Health Initiative, we'll be able to identify populations of kids that have the hardest time getting to us. The digital tools will allow us to reach out to them in their home or in their school or at their pediatrician's office and help get them the care they need when they need it.
What does success look like for you in digital health?
I think success would look like both the patients and their families and their providers and our providers feel like they are more coordinated. I think for families, it would also be less time away from work or home trying to navigate our system. And I think it would also be less onerous for the providers to navigate our system no matter where they are.
Thank you for everything that you and the digital health team are doing. We're really excited, obviously, about how this can change the outcomes for our kids in the years ahead. That's a wrap.